Jefferson Surgical Clinic offers a whole host of services. One of those is vascular surgery, and joining me to talk about what that is and what he does, we have Dr. Brandt. Thank you so much for joining us.
Absolutely, thank you for coming, I appreciate it.
So what is vascular surgery and what do you all do?
So vascular surgery is pretty much vessels in the body, excluding the heart pretty much, but everything else, the neck, abdomen, and the lower legs. We deal with mostly arteries and veins.
Okay.
A lot of times we deal with the artery in the neck related to strokes, and sometimes in the legs related to leg pain or non-healing wounds.
Okay.
Also veins in the legs, cosmetic veins, and veins that are causing problems. And then as well as aneurysms in the belly for the most part.
Okay, and there are a couple different surgeries that you offer, right? There's traditional, is what I was hearing about. So what is that? And then the other one is TCAR?
Yeah, so this is a new procedure that's become more generally available recently in the last year. It's a kind of a hybrid procedure, I would call it. What we traditionally have done is something called a carotid endarterectomy, which is an open procedure for the neck to remove plaque that has caused or can cause a stroke. You do use a stent, but you do it with a cut down on the skin, but you stay away from messing directly with the plaque. And when you talk about that, you talk about decreasing the risk of causing a stroke or causing problems with the incision in the neck, or in people with high-risk situations, not only from like a heart standpoint, but from an anatomical standpoint, meaning a traditional surgery you can't reach it, or if they've had radiation or some other reason why it's difficult to get to that through traditional surgery. This is a very new and very well, at least initially proven surgery to provide those people an alternative to the traditional thing that we do on a daily basis.
And one thing that sets Jefferson Surgical Clinic apart is that it's multiple doctors that can do both of these surgeries,
correct,
right?
Correct.
Okay.
We have 3 surgeons at this time who can perform this surgery. The traditional surgery we all can do, but from a vascular surgery standpoint at this time we have 3 and a 4th that's getting trained soon. So in this procedure in particular, we cut down low on the neck. We get to the artery that's underneath where the plaque typically is, which is higher up. And this goes directly in that artery, and you use it to inject contrast to see where the narrowing is under the x-ray, and then you pass wires through here to get a stent in place to cover up the area that's been the problem, causing a stroke or possibly can cause a stroke depending on how severe the plaque is. What this does, it actually reverses the flow temporarily. It pulls that out, so any type of debris that you're picking up with the wire or the stent or any movement you're doing comes through this system and goes through a filter and comes back out. You actually reconnect it to the vein in the groin and recirculates that blood directly. So not only are you bypassing the cause of stroke from the chest, but any debris that you're moving with putting a stent in, you're filtering out and helping prevent any further stroke or any problem from the surgery. With the data that it's shown and with the comfort you get from not only a smaller incision, but less risk from general anesthesia, you can do it under local anesthesia, regional anesthesia, and just offering them the advantage in certain patients that would be very high risk for these certain procedures, people respond to it very well.
Okay, so if somebody wants to get in touch with you all, how can they do that?
Call us at Jefferson Surgical, 540-283-6000.
Great, thank you so much.
No problem.